Okay, hi everyone. So I'm going to start with this story, okay? We're going to be going all out today. This is our holiday special. Okay, so let me know if this resonates, okay? You are, maybe you're having a little bit of low back pain, right? You're in your mid 40s and then you sneeze. You find yourself grabbing your back and crossing your legs. I'm just going to put it there and hopefully you get the visual because we're going to be talking about all things pelvic health today. And we're going to be tying it to sleep because who knew it is actually completely related to sleep as well. Everything's related to sleep. So I'm making sure we go live on Instagram. And I am just so thrilled to have a friend here. I mean, every episode of Candid Conversations it just has we usually just get the pleasure of having these rare gems. Dr. Noor is one of them, and she's in my backyard. So she's a friend, she's a colleague, she is an amazing woman, brilliant urogynecologist. And I will not even introduce her because I will not do it justice. But let me just tell you, she is changing lives unapologetically. And those uncomfortable conversations that you don't really want to have because you're just like, you're not sure. She's ready to have them. And I love it. I love it. And it's so good to have you here, Dr. Noor.
Oh, Dr. Funke, that was wonderful. Thank you so much for that really warm and inviting introduction. Hi, everybody. I am super excited for this conversation. As Dr. Funke mentioned, I do talk about a lot of uncomfortable things. I am a urogynecologist. That's my specialty, and a pelvic reconstructive surgeon. And for those of you who may not know what that is, I essentially take care of things down there, right? So I take care of various pelvic floor disorders, which can include a lot of different things. And some common things, like Dr. Funke mentioned in her story, is urinary leakage when you don't want it to happen. There are things like pelvic organ prolapse, bowel issues, pain, like having to run to the bathroom, not being able to control your urine, a lot of childbirth related trauma, as well as a lot of, non-surgical things like recurrent urinary tract infections, bladder pain, blood in the urine. So there's a whole gamut of issues that involves your lower urinary tract, that involves your gynecological organs that I take care of. And I'm super excited to share this platform with you all today.
Oh, thank you. All just sounds mind blowing. And thank you for really helping us understand that because I think this is where the issue is. And not just even within people who are like professionals, when we think pelvic floor, we're thinking, okay, intimacy, poop, pee, and you just hope everything turns out right. That's it. You're just like, I don't know. And then, maybe someday you end up in depends, right?
Yeah.
So I just thank you for spending some time here with us to sort of bust some myths, provide some clarification and some understanding. So here is what is going on because this stuff I talked about where I was laughing, all of a sudden I sneeze and everything seems to want to fall apart is not uncommon, right?
Not at all. Not at all.
But it
Pelvic floor.
wasn't happening before. So what in the world is going on here?
Well, you asked the $1,000,000 question, Dr. Funke, and this is something that I hear from my patients all the time. So I think, just giving you a little bit of statistics, which hopefully will kind of put your viewers at ease to give them an idea of how common this is. So if we're talking about, say, things like urinary leakage, like you explained, 1 in 3 women at some point in their life will suffer with urinary leakage. And, traditionally, people used to think that, oh, it's a problem that my grandmother has, or maybe my mother has. I have patients who are in their 20s, because things can start as early as right after, you had childbirth, actually even before that, maybe when you're pregnant. Around the second or third trimester, you start noticing that, okay, like now that, when you have to go to the bathroom, you can't really hold it. Or maybe you had a little sneeze or laughed and coughed and you had a little bit of leakage. And people tell you, oh, it's part of pregnancy, it will get better. And then you have your baby. It's not getting better. It's getting worse. Maybe now you had baby number 2, 3. It's getting worse progressively. And then, of course, the big M word, we go through menopause and everything changes because of all the hormonal issues. All of a sudden, what was a little bit of leakage here and there, it's happening consistently. So to your point, like, why does it happen? there are many factors, right? There are many risk factors as to why women suffer with pelvic floor issues. A lot of it depends on you being pregnant, childbirth related trauma. Age is a big risk factor, like we talked about, going through menopause because hormonal changes happen, as well as some health conditions. People who have chronic constipation or chronic cough, in your world, people who are suffering with obstructive sleep apnea, all these things, any kind of neurological issues, any kind of trauma to your back or your brain, like history of stroke, certain health conditions, all of this can make us more susceptible to developing pelvic floor issues. And what happens is, as we age, we're in our 40s, 50s, and older, with the hormonal changes that happens in menopause, things just seem to kind of worsen exponentially.
Wow. So much to look forward to.
Yes, right? But here's the good news. Even though it sounds like, oh my God, there's no way to escape it, thankfully, in today's day and age, there's so many wonderful treatments, and not every treatment is surgery. People hear my title because it says pelvic reconstructive surgeon, and they think, oh my God, she's going to operate on me. And the good news is, yes, there are surgery for those who want it, but even without surgery, like if we're talking about lifestyle changes, we're talking about behavioral things that you can do, simple steps, simple lifestyle modifications that you can do that can go a long way.
Oh, I love it. And we're definitely going to come to that, because I think a lot of the women that I work with are sort of in that early perimenopause stage. And, they're like, what can I do? How can I prevent or decrease the rate of progression? So talk us through I think I understand the role of pressure, right? If you're constipated, if you've had, you had 8-pound babies, any type of baby, any type of human pushed through there, we understand the pressure and the damage that could cause. But why does perimenopause kind of start to show up with these things? Because that's another thing some of the women I've talked to, they said, they were told it's their hormones. Like, okay, so what now?
Yeah. So I think, perimenopause, as we're learning more about it, right? Menopause is more of a finite time period. Like you don't have your periods or your menses for 12 months. That kind of starts the menopause period or the time period, and then kind of progresses for the rest of your life. Perimenopause is a little bit more confusing, right? Because perimenopause is not a finite time. It can start as early as, for some women, in their late 30s, and it can progress pretty much up until they go into menopause. And what's really happening is, there's no like a test that you can do and then say like, oh, you're in perimenopause, right? So that's the first difficulty, because a lot of it, we're basing it on symptoms that women are complaining of. And up until very recently, we didn't even know what these symptoms are. I'll tell you, I'm somebody who's in my early 40s, and there are days when I'm like, why am I so tired? Like, I'm doing the same thing I was doing maybe a few months ago, but now my body feels different, right? When I'm working out, everything feels different. How I feel is different. I'm a lot more moodier than I used to be. Is it perimenopause? Is it just me working out a lot and not taking care of my body, not getting enough sleep maybe, which we are all guilty of? We just don't know the answer, right? And I think that's where the difficulty is. There are definitely changes that's happening, whether it's physiological, whether it's hormonal, and that affects our emotions, our mood, our sleep pattern, our muscle mass, all of which contribute to affecting your pelvic floor. Because when we think about your pelvic floor, the pelvic floor, really what it is, it's a combination of your muscles, connective tissues, ligaments. And as we age, just like the rest of our body gets weaker if we're not taking care of it, the pelvic floor can get weak as well. And when our pelvic floor is getting weak, all the functions that it used to be doing, which is, support, like, with supporting all your organs, which is all your pelvic organs, which could be for us females, our uterus, our bowel, our bladder, our intestines. So support could be affected. Bodily functions, whether you are able to urinate properly, whether you are able to have a bowel movement properly, those can be affected. Intimacy, right? We didn't even talk about, so sexual dysfunction or pain with intercourse, those can be affected, because if your pelvic floor muscles are not relaxing the right way and contracting the right way when it should be, so many things can be affected. Not to mention, all this plays in our brain and plays in our mind, and that affects us emotionally and mentally as well, and kind of affecting our quality of life overall.
Yeah, no, it's a whole thing. And it's a big deal. And I definitely want to emphasize that piece on the quality of life, right? Being so self-conscious about the changes your body is undergoing and feeling like you're not in control. And I love how you led with the fact that it doesn't mean you have to go through surgery. They're actual interventions. So maybe let's bring this even closer to home. How does this impact sleep? I could tell you some of the symptoms my patients complain about, but I want to hear your perspective. So a lot of women waking up to urinate frequently, barely making it to the bathroom in the middle of the night. Some, like you had mentioned, recurrent urinary tract infections. Now they're peeing frequently. How does that, is that contributed to, is sleep what's leading to that? Maybe sleep disorders, or is it what's affecting their sleep?
Yeah, that's a great question. And the easy answer is it's a two-way street, right? So when you have pelvic floor dysfunction, and when I say pelvic floor dysfunction, it means all the things I just described earlier that your pelvic floor should be doing, the support, the bodily functions, the intimacy, those are not working the right way. And when that's not working the right way, it affects your sleep. I mean, it's so common, like every single day when I'm seeing patients, they'll talk about, Dr. Noor, I'm waking up every couple of hours to go to the bathroom. And you don't have to be a physician or a sleep medicine specialist to understand that if somebody's waking up every 2 hours to go to the bathroom to pee, they're not getting sleep. And guess what happens? The next morning, they're exhausted because their brain is not working. A lot of these patients of mine are older patients. God forbid, they're waking up in the middle of the night and they're trying to, navigate to the bathroom and they fall. I mean, you and I both know, like, after menopause, a hip fracture, it significantly increases your morbidity and basically decreases, like, how, like your mortality significantly, right? So that's one. A lot of my patients suffer with pelvic pain, right? They just cannot relax their pelvic floor muscles. And when you're in constant pain, like constant cramping, and really you cannot do anything to control it, you're not getting that restful sleep, right? A lot of my patients, maybe are suffering with obstructive sleep apnea, something that you treat probably a lot in your practice. And that we know is very directly connected with symptoms like overactive bladder, urinary urgency, not being able to make it to the bathroom. Because what happens is when you have sleep apnea, as your oxygen saturation is getting affected, your body is going to oxidative stress. Not to mention it's putting a lot of stress on your heart, and that releases a specific chemical that tells your kidney to make more urine. So your body is literally making more urine. So of course you're waking up and going to the bathroom. And if you're not being able to control it, you're kind of wetting your bed. It's a mess. And I hear these patients and they're miserable. It gets so upsetting for some patients because they say that I cannot even sleep in the same bed with my partner anymore because I'm so embarrassed that, I'm affecting their sleep. And you can imagine like the toll it takes, the emotional toll it takes. It's affecting not only your physical health, your emotional health, your relationship, basically your social structure. Like I have patients who suffer with these conditions who don't want to go anywhere because they're embarrassed that they smell of urine, because they're probably wearing those heavy duty diapers, because that's really what the options are without treatment. And it truly is heartbreaking.
Oh my goodness. Thank you so much for how you elegantly have described these things. So there's the dysfunction, which might lead to an overactive bladder, maybe just cause. Of course, that's going to affect your sleep quality because you're going to wake up in the morning still tired because your sleep is fragmented, right? We need continuous deep quality sleep to feel refreshed. And then there's on top of that, the sleep apnea piece. And I just want to put a pin on that because that is so important. A lot of the women that I work with, at the end of the day, that's one of the most common things they see. Men also, of course, have it as well. Kids have it too. That same process of your body is under stress and it's causing your heart to say, pump more, make more urine because we're, almost like we're in this very stressful situation.
Absolutely.
And I have seen very directly related treating sleep apnea, improving their urinary frequency. It is
absolutely
wild.
It really is. And thank you for mentioning that, because what I often see is, just like you pointed out, patients come to me, they've probably gone to multiple different doctors complaining about their bladder issues, and they're being treated for their bladder issues and given multiple medications, maybe even some invasive options, but nobody really took the time to address that sleep apnea. Because here's the thing, your bladder problem is just a symptom. The
Mm.
underlying cause is that sleep issue. So I can give you all the world's best medication, do the most perfect surgery, but if you're not going to treat the underlying condition, which in this case is the sleep apnea, it's not going to work and it's not going to last. And here's another thing that I think it's a misconception that people have. People think that obstructive sleep apnea only happens in people who are heavier or are
Mm.
obese, right? So I have some patients, including my own father, actually, who's perfect body. He exercises, but he just has a very anatomically, like a very tight jawline. And, he was just getting so tired and so exhausted. And thankfully, his primary care was smart enough to be like, do you snore at night? Let's just test you for sleep apnea. Lo and behold, like he has horrible sleep apnea.
Wow.
And as soon as we treated him for that, like all his symptoms,
Yeah.
other kinds of symptoms completely disappeared. And so sometimes when I have patients that, I'm looking at them and I'm like, you may have sleep apnea, but in their mind, they're like, I'm not heavy. I work out, I exercise. Like, what are you talking about? But at least getting that evaluated, at least getting a sleep study done can be really helpful.
Oh my goodness, thank you. You're singing my song, speaking my language left, right, and center. But yes, please get tested.
Yeah,
Waking up 2, 3 times at night is not normal, and it will not be solved by dehydrating yourself, by
yes,
saying you're going to stop drinking fluids at 6
yes,
p.m.
yes.
That doesn't fix it. So thank
Yeah,
you.
and you're absolutely right, because that's what my patients are doing, because they're so afraid that they're going to wet their bed or have an accident. They stop drinking, and you and I both know that causes a whole host of other problems, because now
Yeah.
they're dehydrated, they're feeling weak, they're
Mm.
just not like their sodium, their electrolytes are getting affected. So that starts a whole other slew of problems.
Yeah.
And again, all because they didn't just take the time to address their sleep issues in the first
Mm.
place.
So good. So walk us through, we have that woman now who is like, okay, I hear you, Dr. Noor. I am sold. I am going to call a sleep doctor. In fact, I'm calling the Restful Sleep Place tomorrow. But they're still nervous about, just like you said, some of that body confidence. What are some practical things, right? Because it's a journey. The way it works and the way
Absolutely.
we have this in our practices, you have this complaint. Again, you don't have to be overweight. I have women who are thin, who are
Mhm.
very athletic, who are healthy. They're only, gluten-free, vegan, you name it, all of that,
Yeah,
right? And they have sleep apnea. So please don't think it's your size. But then one of the things I let women know is the fact that you're coming to see me is the beginning of the journey. We get you tested,
absolutely.
we start treatment, you use the treatment for some time, then we start to see the improvement. But what are some practical, like you said, some lifestyle changes to that woman who's like, where do I even start?
Yeah. I think, the first thing is starting with acknowledging that
Mm.
something is not right. And it sounds so simple, but you know how, like, one of our mentors says, like, the simplest things is sometimes the hardest thing to do, because it's so simple that it's easy not to do it, because you're like,
Yeah.
no, it has to be more complicated than that. And I think, especially in my world, and I think your world too, Dr. Funke, because we're dealing with quality of life issues, it's very easy to minimize the importance of that, right?
Mm.
I mean, God forbid if somebody has cancer, God forbid somebody has a heart attack. It's not a choice. You have to go
Mm.
to the doctor, you have to treat it. But when somebody is dealing with maybe a leakage of urine, okay, I don't quite feel well, maybe I'm tired, maybe I have sleep apnea, it's
Mm.
not killing me, I'm fine. It's not as important to them, right? So I
Mm.
think the first thing I always try to tell my patients, or even my viewers, because I do a lot of education in social media. I'm a big proponent of education in the digital education space. Um, and the reason for that is, first of all, it's so important for us to acknowledge that these things are problems. I mean, I'll tell you, up until recently, my whole specialty, like urogynecology, we became a specialty only in 2013. So it's a
Wow.
very new field, and even people within healthcare may not realize that there's a whole specialty dedicated to taking care of pelvic floor issues for women, because we realize that this is a niche that needs care. And a gynecologist, which is my background, cannot take care of it because they don't understand the urology or the colorectal part. Urologists, they're just treating the kidneys. They're not really dealing with the female parts. And so you need this specialty like urogynecology, which combines part of gynecology, part of, urology, and also colorectal, and also looking at women as a holistic person, right?
Mm.
And I think the first tip I will say is, anybody who's listening, the fact that you're listening to this podcast means that you're somebody who understands the importance of it and takes this seriously. So I think getting yourself knowledgeable about what are some of these conditions. I hear it often, like from my patients, that, oh, Dr. Noor, I leak here and there a little bit. I wear a little panty liner. It's not a big deal. In which world did we all of a sudden decide wearing a panty liner for the rest of your life and urinating in your underwear is normal, right? It's not. It's just that we as a society has minimized these symptoms that we're suffering with. Similarly, if you're somebody who's constantly having pain with intimacy, don't just assume, oh, it's menopause. You don't have to suffer through it. You should be able to enjoy time with your partner. You should be able to enjoy intimacy and not dread it. And similarly, right, some of my older patients were suffering with overactive bladder. You shouldn't feel that, okay, I'm older, I just have to be sitting at home and not be able to go out. Like, these are concerns that can be addressed. So going back to what are some simple tips? Number one, realize some of these issues that we are touching on are not normal. Yes, they're very common, which is so it's, you should know that you're not the only one who's suffering. And then, if you're in an area where you have access to specialists, please make an appointment, talk to them. I tell patients all the time, like, come see me. Doesn't mean that we have to do anything. The first time I see patients in my office, we're getting a history, we're doing a very thorough exam, and then I'm talking about what are some of their symptoms and what are some treatment options we have. And then together we come up with a plan to see, okay, do we want to do something invasive or something a little bit more extensive? Or do you want to focus on more lifestyle changes, on focusing on strengthening your pelvic floor, like focusing on more conservative options, and then maybe follow up in a few years. And so we can come up with a more individualistic plan that works for each patient.
I love it. Share some of those pelvic floor strengthening exercises. I know that's been a big piece. And also, I think there's sometimes when patients may need to be referred to like a pelvic floor physical therapy, and then maybe even some dietary things, because you mentioned constipation and all of that.
Absolutely. I think, the first thing I tell patient is focus on avoiding risk factors, right? So what are some of the risk factors we talked about? Constipation is a big one. So if you're somebody who's been suffering with constipation throughout your life, really take the time to focus on how you can get it better. So make sure you're up to date on your fibers. The recommendation is at least 30 to 35 grams of fibers every day. And I'll tell you, just apples and broccoli doesn't do it. Sometimes you may need some fiber supplements. It doesn't have to be crazy. Just over the counter, get something that you can tolerate and doesn't give you a lot of gas or bloating. Start with that. Make sure you're hydrating yourself, right? Because a lot of my patients, because they're leaking urine, they try to dehydrate themselves, and that causes a whole slew of other problems. So make sure you're getting your hydration. Avoid things that can irritate your bladder. We love our coffee. I'm just as guilty. But these are known bladder irritants, things like caffeinated beverages, carbonated beverages, even things like artificial sweeteners, dark chocolates, spicy food, citrusy food.
You're taking everything away from us.
I know. And I tell patients, I'm not going to take them all away, but be aware. So if you know, say, for example, tomorrow I have a big day or I'm traveling, maybe today's not the best day to have those things. On the other hand, if you know that, what, Dr. Noor, I need my morning coffee, just be prepared so you can plan your day and it's not a surprise. And then focusing on strengthening your pelvic floor muscles, right? Because remember, we talked about the pelvic floor muscle is your support for the pelvic organs. And just like any other muscle, it needs love, it needs attention. You have to work on trying to make it stronger. I tell every woman in my office, you go to the gym, you're exercising anyways, dedicate like 5 to 10 minutes for your pelvic floor. Focus on doing some of those Kegel exercises, some of those strengthening exercises. And here's the other thing. Kegel exercises also is not for everybody. So if you're somebody who has tight pelvic floor muscles and you're having symptoms of pain and discomfort, not being able to empty your bladder or urine, you actually need to learn how to relax your pelvic floor muscles, the opposite of Kegels. So it may sound very confusing. You're like, Dr. Noor, what on earth are you telling? You're just contradicting yourself. I am not. All this to say, sometimes you need that special touch from a specialist, which could be somebody like myself, or like you mentioned, a pelvic floor physical therapist, not just any physical therapist, but somebody who is a pelvic floor physical therapist, because you need somebody with experience. When I have a heart problem, I don't go to a diabetes doctor, right? I go to a cardiologist. So same thing. When you're having shoulder issues, you can go to somebody who takes care of your shoulder. But if you're having pelvic floor issues, you want to go to somebody who does this every day, because you need that nuanced understanding and explanation.
Oh my goodness. Thank you for highlighting that, because when you think pelvic floor exercises, the first thing that comes to mind is Kegel, right? Right
Yeah.
away. And I'm sure most people, as you hear that word, you're probably tightening some specific areas of your body,
Yeah, and
you
with
know?
Kegel too,
Yeah.
Dr. Funke, I'll say I have patients who come to my office and they'll tell me, Dr. Noor, I've been doing Kegels for the last 2 years. And when I go
Mm.
and try to evaluate the strength of their Kegels, they're not even isolating the right muscles, right?
Oh,
Because
God.
again, these are muscles that are internal. We don't see our pelvic
Mm.
floor muscles. So
Yeah.
you may think you're doing Kegels every single day, but you may not be doing it correctly. And I have many videos on my YouTube channel talking about how to do them correctly, because that makes a huge difference.
Oh my goodness. So I think that is an amazing segue to that YouTube channel. You guys, I just want you to know, Dr. Noor she's a superstar. I mean I'm in the front of greatness. She has amazing content. She's a teacher, as you can tell, and she makes this thing very relatable and practical. Like, these are things you can start tonight, right? And I just want to recap it, and then we're gonna, because I feel like we just have to carry this conversation into the YouTube channel, because there's just so much, there's so much to take away. So make sure you're taking adequate amount of fiber, and the broccoli, and like, depending on, especially for a lot of the busy women that I take care of, like, you're not taking enough fiber. Like, that bowl
Mhm.
of salad you take at lunch, like, it is not enough. So
Yeah.
find some fiber supplements if you need to. Hydration, I think this is
Yeah.
huge, because again, because you're scared you're going to wake up and pee, now you dehydrate yourself. And if you think about it, if you're asleep for 8 hours, that's 8 hours completely
Mhm.
dehydrated, and now you're backed up. Now that puts additional pressure to that pelvic floor region, and so it's a vicious cycle. And the caffeine, the spicy stuff, like, knowledge is power. The same way I tell people, like, yeah, I want you to sleep 7 to 9 hours a day at night, but if you have to go to a party, you have to go to a party. Just plan your life around it. So the same thing, if you need to drink
Yeah.
your caffeine, if you need to take your alcohol, if you want to, take your hot, spicy, you know what it is, right? Just plan around it. It's not meant, these things are not meant to restrict you. They're meant to
Absolutely.
liberate you by
Yeah.
empowering you with the right information, so that you can take the next right step, right? Pelvic floor strengthening exercises, depending on what you have. And I think this is very important. So don't just go off to Google or ask ChatGPT for pelvic floor strengthening exercises. Just go straight to Dr. Nabila Noor's YouTube channel, because that way you know what you're doing. You're not actually making things worse for yourself. And of course, the overarching piece of this is address the root cause. If you're out there and you're a woman and you're telling me you're waking up 2, 3 times at night, it is not normal. It is not normal. It is not normal. Whether you're thin, whether you snore or not,
Yeah.
still get evaluated, because some women don't even snore very loudly. And so people may not notice, right? So pay attention to this. Like, these are 6 powerful tips, and I think this is a great place to kind of pause and just learn a little bit more about where to find you. Because me, I'm just like, give me more, Dr. Noor, give us more.
Well, and
So
I
where
think,
can we find you?
that's why, Dr. Funke, like
Yeah.
both of us are in Pennsylvania, in Eastern Pennsylvania, and we're very fortunate that we're in a place where we have access to some of these specialists, right? Whether it's a sleep specialist like yourself, you're a gynecologist like myself, we work with a lot of physical therapists, we work with a lot of, qualified individuals who really can help anybody who's in the area, and primarily in majority parts of the United States. So I really tell my patients that in today's day and age, there's really no excuse for not seeking the care. A lot of it is really us prioritizing ourselves. And as females, we are both guilty of it. We all know we prioritize the rest of our family, kids, husbands, parents, everybody. We put ourselves last. I'm just as guilty. But, it's not a blame. It's just kind of resetting as we're going into 2026. Know that, what, I'm going to prioritize myself. And let's just start with having a consultation. Maybe it could just be an hour of your day. And if everything's fine, we do an evaluation, all's good. you can put yourself, you can have that peace of mind that, okay, you know what, I can just focus on the easy stuff. And that way I can do so much for my future self and not have to suffer in the long run.
I love it. I love it. I love it. And I'm gonna just so what's your I mean, I know a lot of your content is on women's health, but tell us a little bit about your YouTube, because I think I subscribed and I listen and it's just so powerful. But what's your mission behind it? What do you expect people to get from it? And why should people from this specific conversation head over to click subscribe?
No, absolutely. I think, my big arching mission is to make these conversations about pelvic health mainstream. Like, there's so much taboo and stigma and misinformation attached to this. The first and simplest thing is I want to make this conversation just as simple and as casual as, say, when we talk about our heart or our brain, right? There's a lot of misunderstanding about women's pelvic health and what are some options available. There's this concept that, okay, these are all normal parts of aging. They're not. And like I was talking about earlier, a lot of these conditions, we have amazing treatment options. But I also understand, as subspecialists like myself, there aren't that many of us. And I have so many patients who travel hours to just come see me. But here's the thing. A lot of the things that I do is education, just like we were talking about today. A lot of it can be prevented with conservative stuff. And so that person who's traveling 2 hours to see me may not need to do that if they just go to my YouTube channel and start learning about these topics and start doing some of the things we're talking about, focusing on some of the lifestyle changes. And if those things are not improving their symptoms, that's a time when they can come and see a specialist like myself. Again, I will see anybody, but sometimes, like I said, patients may not have access to a PT directly or a specialist. And this is an amazing resource from a board certified urogynecologist, somebody who does this every day, takes care of thousands of women. I've been doing this for almost a decade of my life. And I really do value that anybody in the world, and which is why I do it in multiple languages too, that anybody in 2025, 2026 should have access to information. And that should not be a reason why they're not seeking care.
Absolutely. So you guys save yourself the trip down. I mean, I think Dr. Noor will be more than happy to see you and serve you.
I'll be happy to see you.
On your way there, stop by YouTube at Nabila Noor MD to learn. I mean, it is you share so much value. It's incredible. And thank you so much for doing this. It's clearly a mission. Your heart is in it. And I just can't imagine how many more thousands and thousands of women you'll be continue to help. So you guys give Dr. Noor a follow at Dr. Nabila Noor MD. And I believe you're the same on like Instagram and
so Instagram, and I'm also on TikTok. Those are actually Dr. Nabila Noor. Yes. So please follow. I have many patients who follow me, and I actually have patients sometimes will send me information and want my opinion. So I try to make the information available as practical as possible to help as many people as I can.
Wonderful, wonderful. Well, this has been, for one, I've learned a lot. Guess what? I'm going to go order. I'm going to go get some fiber because I am not taking enough like most of the women.
I know.
And just really, I think what I love the most about this is these are practical things we can start with today. And as we this is the end of the year, depending on when you're watching this, 2025, what better goals you can set for your health than to say, I'm going to start by drinking more water. I'm going to start by subscribing to educational content so I can be a better version of myself. So I know the evidence-based strategies I need to take. I'm going to finally get my sleep check by calling or checking in or visiting the restfulsleepplace.com so that I can get answers to the sleep issue. So I think this is just a powerful, powerful episode. And so if you're out there and you're watching this, again, Dr. Nabila Noor MD, you need to subscribe and watch her YouTube. Check us out at therestfulsleepplace.com if you have sleep issues, because we focus on root cause. That's what we're all about. And that's why we bring experts like Dr. Noor on here, just to share some of these things so that your life can be better. Thank you again so much, Dr. Noor.
Thank you so much, Dr. Funke. I had a wonderful time. And just like you mentioned, I think, the beauty of, having these conversations is we learn from each other. There are things that we see in patients, questions that come up. And when I speak to a specialist like yourself, and we can kind of tie in the pieces, so much better care that we can provide for our patients. So hopefully this conversation would be valuable. And yeah, please seek us out. We are so happy to take care of patients. We love what we do. This is why we talk about it, we practice it. And, please do take the time to take care of yourself this new year.
Amazing, amazing. Well, on that note, Merry Christmas, Happy Holidays, everyone, and a Happy New Year. And until next time, I hope you rest well.
Happy holidays, everyone.